Welcome to blackdoctor.org, where wellness and culture connect. I'm your favorite girl, Dr. Cordai Dakota, board certified podiatrist, fellow of the Academy of Foot and Ankle Surgery, and podiatrist for Neighborhood Health, a federally qualified health center in New Jersey, providing care for all, regardless of status or insurance. I am also the co founder of Sisters in Podiatry, a Facebook group for Black women in podiatry across the US and Caribbean, and your host of our lovely show, Stepping Forward, Dr. D, your gateway to all things of the lower extremity. Guess what? It is Women's History Month. So I'm going to play y'all a little something. One of my artists that I love, because guess what? As much as I know, what? Indeed. Yes, we run the world. And I am so excited to bring on a fabulous practice in New York City, all women based, to Healthy Feet. And I am tickled pink because I love who we're bringing on. And I'm going to introduce our first guest. Our first guest is Dr. Tiffany Gooden. And what I love about Tiffany Gooden, throw up that pinky, sis. She is a member of the what? The Alpha Kappa Alpha Sorority Incorporated. Dr. Gooden is a chief operating officer to Healthy Feet Podiatry. She is a bad chick, as she has a doctorate in business administration from the SDA Bocconi School of Management in Milan, Italy. We want that story, my love. She is a native New Yorker and a graduate of the Ethical Culture Fieldston Schools and Marymount Manhattan College. I used to live right by that school in Riverdale. She is an active member of the lovely sorority that we mentioned. Dr. Gooden, we welcome you.
Thank you, Corda. Thanks for having us.
Absolutely. Our next fabulous guest is the owner of this practice, Dr. Farah Alani. Dr. Alani.
Hi, everyone.
Hi.
Thanks for having us, Dr. D.
I am so happy to have you. She is an alum. She is a New York City foot and ankle surgeon. Her practice focuses on non-invasive surgery, regenerative medicine. I know some of y'all are like, what? You're going to find out what that is. And innovative techniques. She attended the University of Western Ontario. I'm Canadian, so I love that. Rosalind Franklin Med School, and completed her residency in Orange County, California, and Brooklyn, New York. We know how our New Yorkers love Brooklyn. She completed her fellowship in dermatology and pathology. She was recognized for outstanding community service by the state of New York and spoke at the United Nations Women's Entrepreneurship Day. We have that in common. I spoke for the UN as well for breast cancer, my other arm of my business. So I love it. Welcome. Our next guest, and I'm not sure if I'm doing this in any particular order, so forgive me, is Dr. Bell.
Hi, guys.
Hi. Dr. Allison Bell is a Manhattan native. You know, New Yorkers, they love that. With a medical degree from Kent State University. She also completed a fellowship in Sacramento, California, where she specialized in limb salvage, trauma, and nerve repair. She prioritizes non-surgical treatments with her patients and is a director of clinical medicine and training to Healthy Feet. Thank you so much for being here.
Thank you for having me. I'm so excited.
I'm so excited tonight too. Our next guest, I know y'all are like, how many guests does she have? I have a lot. Our next guest is Dr. Nancy Artis.
Hi, everyone.
Hi, Dr.
Good evening.
So Dr. Nancy Artis is a podiatrist with over 10 years of experience, even though she looks so young. That's like good black. She received her doctorate from the podiatric medicine from the Ohio College of Podiatric Medicine, Kent State University. She is a native New Yorker, a Syracuse University graduate, and a member of the what? The Alpha Kappa Alpha Sorority Incorporated. No, it's not ready. It's too much of us. And she's fluent in Spanish, just like me, Dr. Artis. So welcome.
Thank you for having me.
And our last guest, I think, am I correct, is Dr. Roxanne Clark. Hi, Dr. Clark.
Hello, good evening, everyone. Thanks for having us.
Thank you for being here. Dr. Roxanne Clark has her doctorate in podiatric medicine from the what? New York College of Podiatric Medicine, like me. And she trained in podiatric medicine and reconstructive foot and ankle surgery at the New York Methodist Hospital, Brooklyn. She is board certified in minimally invasive foot and ankle surgery and is the chief scientific officer at Ali Shoes. I want to hear about that. I think I'm saying it right. Ali, am I correct?
Ally.
Ally. I apologize. She is a published author in the Journal of Foot and Ankle Surgery. Welcome to the show. I think we have all our guests on. Am I correct? All righty. I love that first, we like to give shout outs. So people watching, we love you. Tell me where you're from. You Brooklyn, you New York, Arkansas, LA, wherever, Canada. We want to know and we want to shout you out. We're also celebrating 1 year of stepping forward with Dr. D on the air. And I said, what a great time to celebrate Women's History Month with these lovely, fierce, dynamic women. So I'm going to start with Dr. Farah Alani. Dr. Alani, this is amazing to have a practice of these dynamic women in the heart of the city. Tell us, what made you say, this is a great idea, let's do this?
Well, I don't know if it started as an idea, but I definitely feel privileged to work with all of these really brilliant women. And in fact, today I shot a quick X-ray image to the whole group and said, guys, what do you think? Do we operate? Do we not operate? Where do you go? And so I feel really privileged to have this group of amazing, really talented doctors around me. And it didn't start that way necessarily. It started with just me. And then it grew to another doctor, and it grew to needing to grow the practice and seeing opportunity with another location, and then needing to bring on board more people. And I think this iteration of the team we have is our best, our brightest, our most enthusiastic. Everyone on the team is extremely caring and extremely caring towards their patients. So it is what it is, just based on time and need for growth. But we've brought on the best and brightest, I think.
You absolutely did. You absolutely did. And then you have a COO. Now, everybody doesn't have that for a practice. So Dr. Gooden, Tiffany, tell us what that means and how you benefit this practice. Because I think podiatrists are like, wait a minute, you have a COO. Do tell.
I don't know that I was what Dr. Alani was looking for when she hired me. And I don't know that I was looking for to do anything that was in podiatry. Mm-hmm. However, I could see where kind of the growth was going, what the possibility of the practice could be. So it was something that was really interesting for me. And I love our team. I've been there at Healthy Feet Podiatry now for 5 years. And I just love this iteration of everyone. I'm so sorry. We have one more doctor, Dr. Ricks, who wasn't able to join us tonight. And our team is wonderful. And these are some of the most brilliant women I've ever worked with, brilliant people I've ever worked with. And it's an honor every day to be able to work with these women.
I love it. I love when I hear the positivity. You're seeing women and women of color, and it's just that we're celebrating each other because we're fabulous and not tearing each other down. So this is just an amazing, I am, like I said, tickled pink. Yes, I'll use pink because I think this is an amazing group. So let me get into some of the doctors. So Dr. Roxanne Clark, you're with an all-women group. Why did you choose it? And what do you think makes you special in this group? Why would I see Dr. Clark?
I'm not sure if I chose it, but it chose me. I think most of our experiences as doctors that are women of color, Black in this field, it's not a lot of us. So when we're first leaving residency and going out to work, you're surrounded by, your male colleagues. It's predominantly male. So just searching for something different from what I've experienced, I was lucky enough to meet Dr. Alani and find out that this is what her practice was structured as. And ever since joining, it's been a great experience. Really don't have to worry about what you worry about regularly, just taking care of your patients and supporting each other, which is, I think, unique to this practice. compared to what I've experienced since leaving residency.
Absolutely. And I'm going to pass the next question on to Dr. Artis, but I want to give a shout out. Thank you, Kawana Daniels, for watching. We appreciate it. Again, let us know where you're coming from, what you're watching, what are you doing, what town. We want to hear it all. I'm going to ask the same question to Dr. Artis. Why choose this practice? And what do you think you bring your special flavor to the practice? Same question for you, Dr. Bell, in 1 second.
So this is my first job out of residency.
Congrats.
Thank you. And what a perfect job to have fresh out of residency, because everyone here is so supportive. You're nervous, you're like, you have questions, you have doubts, and anytime I go to any of these wonderful ladies, doctors, and say, hey, I'm not sure about this, or it's like, okay, they pick my brain. What do you think? How do you feel? They help me, feel confident in the sense of you got this. Like, just take a deep breath. You got this. We're here for you. And that's such a beautiful thing. I really don't think I would have gotten this from any other place. So it's just a blessing to be here. So why did I choose this practice? Again, it's just the support from day one, meeting Dr. Alani, speaking to her. I felt very comfortable. And Tiffany, during my interview, I felt like, I don't want to say like I wasn't being judged or anything, but I just felt like, hey,
You find your connection.
yes, it's like, we get you. I see you, I get you, I understand where you're coming from, and that's what made me really fall into this practice, and I'm very grateful to be here.
I love it. Dr. Bell, why did you choose this practice, and what do you think you bring to the practice?
Oh, wow. So this was not my first job. I had a job prior to this, and it was so eye-opening to see that outside of the standard male-dominated field, there is potential for all women and all women of color to work together positively and thrive. So I think I stumbled upon this. Like, I just be doing stuff. So I was just applying places, and Dr. Lonnie called me. She was like, you know what? I like your resume. It's pink. That's one of those vibes, And we got to talking, and I really think that like our practice style and like our mission with patients really aligned. So much so that I'm like, okay, sure, like I'll relocate. Like, let's do this.
Where did you relocate from?
California. So I'm actually
Wow.
a California native. So I relocated from California to join this practice, and just being able to see the camaraderie around and how everyone kind of just hustles together. It's not a competitive environment, which is what I came from. People were just hustling for patients. They're like undercutting or trying to take each other's patients. We don't have that here. And I think it's a very fortunate and a very blessed situation to be in. You said, what do I bring to the practice?
Yes.
I don't know. I feel like I bring baked goods, so I like to bake. So I bring baked goods.
I'm coming to visit because I love.
Yeah, I bring the baked goods and the vibes. No, but I feel like I'm able to share ideas and they not fall on deaf ears, or like I can be like, hey, would you be open to trying this modality? And everyone's input is very sound and very on board. Like, sure, let's give it a try. So
that's a blessing, because as we
very
know,
much so.
if you're, I won't say what my age is, but yeah, if you have been in private practice, I've been in private practice, I've been in multidisciplinary and federally qualified health centers, various hospitals, male dominated. Sometimes your what you say may not be respected, or if they're shocked that you know so much. So,
Yes.
And as Black women, even more so. So I applaud what you're saying. And,
Yes.
Kudos to Dr. Alani.
Yeah, very blessed to be here.
I love it. So, Dr. Alani, you have this fabulous team. I mean, you have the A team. So, New York, we know New York City, there's tons of practices, okay? And so why, you pick this team because at the end of the day, it's strategic. I'm going to start with you and we'll go through. If I'm coming to your practice and I say, I'm going to see Dr. Alani, what would you say to patient? Why would I see you versus anybody else in the practice or anybody in terms of your competitors in New York City? What do you think your je ne sais quoi is for the practice that makes you stand out to Healthy Feet Podiatry?
So I really truly think that we stand out as a practice, and I stand out as a doctor because of the team. And I would have not hired any of these doctors that we have on the team if I wouldn't be okay with my mother or my son seeing them. So when people say, I'm going to come in and see you, sometimes they're friends and family of my own. I'm like, well, you want to be seen on a Saturday? You're going to see Dr. Ricks. You're going to see Dr. Bell. You're going to see Dr. Artis or Dr. Clark. Dr. Clark doesn't work on Saturdays. So I didn't mention her name, but, and they're like, oh, we want to see, I said, you know what? Dr. Bell is excellent at this. And as are the other doctors. And, every doctor does have something that I think they specialize in, Dr. Clark is kind of our minimally invasive guru. And I'm so grateful to be able to learn from her. And, Dr. Bell has a lot of trauma experience. So I'm grateful for every skill that every single member of the team brings to the table. And I myself will say, you know what, this is something I haven't seen since residency, or this is something I don't really do often. Go see Dr. Bell, go see Dr. Artis, go see Dr. Clark. And I feel like my biggest asset as a podiatrist is the team, because it doesn't just come with my skill, it comes with the skills of five other people.
I love it. So questions. So we're going to go back to Dr. Bell because you hit on there. Everybody, and I was trying to pull that out of you guys, everybody has a thing that they do in podiatry. Well, I am known, published for my cosmetic incisions. That's what I do well, and some other things. So yeah, Dr. Bell's like, yeah. So Dr. Bell, since I keep throwing it to you, we're going to start with you. If I'm coming to the practice and I am a patient and I might have a multitude of things. And I said, well, I don't know who I want to see. Dr. Bell, what is it that you do? What is your Black girl magic? What is the thing that you think you do well that I would say, okay, that's what I'm going to see you for?
Oh, that's such a hard question.
Pick some good answers.
It's a challenging question simply because if it's something that I'm not comfortable with, I can call up Artis or Clark and say, hey, look, could you help me with this? Can I just?
Well, what do you do? We're going to get to the other ladies who are amazing as well.
You know what?
I can say she can fix a fifth metatarsal fracture with hardware in under 5 minutes with her eyes closed.
I'm handy with tools. So, I mean, I guess like any ORAF, any big open things. I'm not great with little things, little dainty things. These big hands, these are 7/7 glove hands.
For those who don't know, gloves are in sizes.
Yes.
And so 7 to me is no big deal. I don't know why you're saying that. I'm a 6.5, 7, but
all
the
of
numbers
these
go
people,
bigger.
All of these people here, I'm the only one that uses the large gloves in our whole practice. Right. They buy them just for me. These big hands. So I would say for me, it would be big open procedures. So trauma and big bunions.
Understood. And we want to give a shout out. Thank you, Pearl Phillips from Glen Ridge, New Jersey. Jersey's hot in the house. We see Michelle Reynolds West. Thank you for tuning in. Dr. Clark, I'm going to jump to you for a second. I'm a patient and I'm like, why should I see you? What is the thing that you think you do very well?
Well, as Dr. Alani mentioned, I'm the minimally invasive surgeon of the practice.
So what does that mean? Because for people watching here, they're like, I don't know what does that mean? Tell us.
So pretty much minimally invasive, everything through very small incision, reduction of deformities through a small incision that allows you to start getting back to life after surgery. So I commonly do bunionectomies under minimally invasive technique. And the goal is to have patients walking back in their regular shoes at 2 weeks. The demographic of patients that we treat are mostly working professionals in New York City. Their shoes hurt, or they don't like, how their feet look, or both. And they want a solution that allows them to get back to what they're doing, whether it's, training for the marathon or just getting back to work. And so I present that option to them in the practice, and I enjoy it.
Fantastic.
I just want to add, and
sorry.
she's very, very good at it. Very, very good at it.
All right. I like that.
Thanks,
So good to
Allison.
know. Good to know. Dr. Artis, what's your special sick flavor that you bring if I came to see you?
Well, man, that is a very good question. I'm sitting here really like thinking. So, I can't really put my finger on something yet. Okay, Dr. Bell, because
I'm going to say
She
that our
is
Dr. Artis
amazing
is
with
very
patients. She is solid with patients. They always keep coming back to see her. And some patients, they might be healed and they still just want to come see her. She is amazing with patients.
Some patients are challenging based on like what they're going through. They've had this pain or problem for years and years, and Dr. Artis is like the patient whisperer.
100% agree. 100% agree.
Yeah.
Thank you so much. Yes, that is my niche. That is my thing. Thank you so much, Dr. Bell and Dr.
And I
Clark.
love that.
appreciate
Even
it.
that was a good thing. Nobody let you fall. You realize that they all lifted
Yes,
you
absolutely.
up. You were like,
Absolutely.
okay, I'm
Oh yeah,
out
we don't do that.
and Dr. Bell was like, oh no.
No, we don't do that.
All right, I see. It's like you're on your own sorority, feet 5 feet. I love it.
Hey.
So
change our name.
there you
Sounds
go.
like a
Feet 5
good
feet.
idea.
So let's ask another question. So patient care is big. People want to be seen. People want to be heard. A lot of times we hear in minority communities that they're not heard. They didn't get what I was trying to say, or I didn't feel seen or heard. And that comes back to how doctors relate. And Dr. Artis, you seem to be like we'll call you the G for tonight on that. And also running a practice to make sure that they're doing it correctly. So I'm going to start with Dr. Good and Tiffany. Tell me, because that's such a big thing that we keep hearing, especially in the African American community, what is your role to make sure that people come in, feel great, feel seen and leave and come back? Because that's the best thing that you can do, is that you were seen, but I'm coming back, and I'm coming back with a friend or two, because I just loved when I saw Dr. So-and-so and this was fantastic. Tell us about that.
That's right. For me, and they can all attest to this, it's about trying to hear as much as I can, trying to see as much as I can, correct things in the moment, adapt when necessary. And also just making sure that every single patient, every single staff member, every doctor is treated well and with respect. And I think that that's the most important thing. And I think that shows throughout all of our patient care at all of our locations and with our staff as well.
So, question of the it's Women's History Month. We're women, and that's an amazing thing. I'll throw that to Dr. Alani. Do you think that a female-based practice makes a difference in the community? And tell us also, what is the percentage of women that you see in your practice?
Those are great questions. I do think that people see us as a group of women and are drawn to it. I think there was an article that came out, and it might have been the Times, or I'm not sure where it was, not long ago, but it was probably based on primary care or like cardiology or something, maybe not podiatry, but it says if you have a female doctor, you'll live longer. And I don't know how many of our patients read that article, but I definitely think that our patients feel heard. And I think that they feel like what they're saying and their pain and their struggles are not falling to deaf ears, that we really care. And so I don't know that you would get that specifically from a female versus a male, but I do think that having an all-female practice, I think people are attracted to it. I think they're excited for the fact that they're also supporting women, and they're supporting women of color. And I think our patients all leave with a very satisfied sense of, I got heard, I got treated, and I was given all the options, and I wasn't treated any differently than I would have been anywhere else. So I think there's definitely a positive aspect. I don't know if people are only seeing us because we're women, but I definitely think for some people, it really does matter, and they're very attracted to the practice for that reason.
What percentage of patients would you say are female that you see?
That is a good question. I don't know if we've ever done any analysis, but I would say it's 50-50 or maybe 60-40 female.
Okay.
Would you all agree? Would you all say it's even across the board?
It's definitely a
Yeah.
larger female population. I've noticed
I
60
love
40
it.
maybe.
60,
Yeah.
40. Okay.
Mm-hmm.
Okay. So let me ask this question. So patients. So, and I know this happens because it's happened to me, Dr. Lani. I think we're closer in age. So I'm not sure about everyone else, but I'm sure there are times where I can call that sometimes you have a patient and they see you and they're like, who are you? I remember being at a hospital. I won't name the hospital to do that to them, but during I was an attending already, and I guess I look young, and I was with the residents, and I was the only African American, and I was the only female. I was the attending, and I knew the family, and I was running late, so I came in, went down to the OR, and told them, "Hey, great, I'll bring the patient." For those who don't know, they love when we bring the patient down. It's less work for the hospital. Sometimes they have transporters transporting many of people, so if the doctor can bring them down with the team, that just made a happy OR. I went to the floor, and one of the nurses started, a Jamaican nurse. I'm West Indian, so I'll claim my West Indian people. And she said, "I don't know where your doctor is, but da, 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 and she's not here, blah, 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 blah." And she's getting vexed. And I'm like, so the residents are looking at me terrified, the men, and they're like, I said, "Don't say nothing." And so she's going on, and I'm there like, and so finally I walked and I spun around with the coat flying. I said, "I'm Dr. Dakota, and what you need to do is read this. I am the one in charge. Got it?" And I had them get the patient ready. And I'm looking at her walking. And then I went up to her. I said, "What was it? Too young, too black, female, which one?" And she stuttering. And I said, "Why do we do that to each other? Why couldn't I be the attending? Why did I have to be maybe a resident and an insignificant resident?" So I do think that you will have sometimes, unfortunately, people who get shocked, if they haven't looked up the practice online to see who you are. Have you ladies ever experienced that through residency and or in the practice that you're in? And I'll start with Dr. Artis, being the youngest.
Thank you. I'm not the youngest, but thank you. But thank you. Yes, I've experienced that a lot. Uh, even as a student, and rotating and doing externships, and then yes, unfortunately in a residency, walking in. So I um I did half of my residency in Ohio before transferring here to New York in Brooklyn. And, there's times you'll walk into the room and they don't think you're the doctor. They think you're somebody else or you're here to help. And it's like, like I don't mind doing certain things, but just know that's not like I'm here I am your doctor. I'm here, to help you, for you. And sometimes you have to tell them and you have to stop, you have to pause. And I've had it to the point where we went to a nursing home in Ohio, and I had a patient call me the N-word, so it's a lot that you do deal with, and it's a lot of things that we don't talk about. And
Absolutely.
sometimes we internalize it. And I'm pretty sure every one of us here can write a book on our
Yes. Yes,
experiences.
ma'am.
Yeah. Because when you tell people, sometimes they're like, "No, I can't believe it." Walk in my shoes and you'll see. So yes, I did experience it.
Absolutely. Dr. Clark.
Yeah, I mean, the I'm not trying to get political on here, but the the climate that we're in and the fight for DEI, whatever, just the existence of DEI alone, I feel explains, our experiences, even if you're at, you come in and you introduce yourself as Dr. Clark, you're referred to as everything but doctor, right? And then when you are, accepted as the doctor, it's like, "Oh, how long have you been practicing?" I always get the joke, is this your first time doing this surgery? It's a joke, but it's kind of like,
it's a sarcastic joke.
Yeah. And I've been practicing since 2012. So, and one part of me is like, oh, you think I look that young? The other part of me is like, would you ask somebody that's, a white male this question? But I feel like these experiences that we have as Black women, women of color, we bring that to the bedside, which makes us more empathetic to, the patients that we treat, whether you're, Black from a different country, from a different community. Through our experiences, I think it gives us that extra, like, I know what you're going through. I'm also a patient. I've been a patient, even though I'm a doctor. I know how it feels to be treated a certain way. So I think that is special and unique to what we bring to the practice. And I think why people seek us,
Absolutely. Dr. Bell, great stories. I feel like we could all write a book. Dr. Bell.
Yeah, I think I can mimic everything that has been said. It's just I'm a little different in my approach. I meet weird with weird. So when you say, have you done this procedure before? I'm very good at being like, you know what, I was the janitor yesterday and they promoted me. And, I think that it makes the patient take a second and step back, like, okay, like I should chill. This probably wasn't the most appropriate thing to say right before we're going into the operating room. On the flip side, right? I will say that being here at this practice, I have never had that issue. I am so grateful that one, the patient picked you. They saw you and they picked you. They knew what you looked like and they knew who they were coming to see. Mm-hmm. So I will say, because I think that was part of your question too, have we experienced it here? And I will say I don't know, like I think I made 2 years a couple months ago here now. And in those 2 years, I have never experienced that here in this practice where someone was confused on one, who I was or my abilities to take care of them.
I love it. Before I go to Dr. Alani, we're going to give some shout outs. So we see Yolanders Carter from the Lou, St. Louis, Missouri. Thank you so much for tuning in. We see Nancy Marie Sunshine, one of my sorority sisters of the Alpha Kappa Alpha Sorority Incorporated Sorors. Thank you so much from Somerset, New Jersey. And Margaret Jackson, hello, from Snellville, Georgia. Thank you so much for tuning in. We appreciate the support. Dr. Alani, same question to you.
Yeah, I think I have to have a similar experience with Dr. Bell and in the hospital and residency. Yes, it's definitely happened a lot. In our private practice, I can maybe count on a hand how many times I have felt, spoken to inferiorly with a patient. And similar to Dr. Bell, there was one patient who had done all their research and came to see me from far away and, said, and had all these questions. And I said, well, you've done your research. Do you want me to help you or not? And it was just, well, no, I came here because I need your help. And then, okay, then let's proceed. But it doesn't happen a lot. And I think people maybe know who we are before they come and see us. And that might allude to the fact that they came to us for a reason.
I love it. I love it. So
I think they've also come to us realizing and knowing that the hoops that some of these women may have had to jump to get through to where they are. And so they come saying, you know what? They have experience. I know to get to this place in New York City, right? One of the most competitive places in the world. They must be amazing. So I think a lot of our patients have picked the practice based on that as well.
I love it. I used to practice in the Bronx, and I used to practice in Washington Heights, and I speak Spanish in Queens. And so sometimes people, especially before everybody was doing, having social media as much and having your websites, people with the name Corday Dakota, they didn't know what they're getting. They're like, wait, and they're shocked. I mean, you can see it in their face, like, who is this? Who is she? And to your question or point, Dr. Bell, I had somebody said, yeah, you sure you know what you're doing? And I said, I've been running this all day and will continue to run this all day. And they give the grin. And usually we're good at that point. I've experienced patients that just refused and wanted me to be me to touch them because I was a Black woman. You just were like, absolutely cannot touch me. And I'm not that person to beg for anything. It's not in my DNA where I'm like, okay, you can wait all night if you like to, because when you're in residency, you're the highest in the hospital. So what you gonna do? What you gonna do? But I'm glad that we're breaking more barriers and there's more women coming into podiatry. And I'm so glad that, especially my class, 2001 from NYCPM, a lot of women are doing quite well in practice, regardless, background, color, what have you. And it should be that, yes, women, we give an extra little zhuzh in what we do, but we're just as qualified as our male counterparts. And that's something that we always want to make sure that we reinforce. So let me ask another fabulous question. So you have this women practice. I know surgery, people want to get this stuff fixed, right? And, sometimes there are people who will try very conservative options first. Some people are like, okay, we're going to do a couple of that and we're going straight to surgery. Dr. Clark, I love MIS. I don't do it as much. And we'll talk about some more surgical techniques as we go. But when do you say enough is enough? We're going to hop to a surgical procedure because we're talking MIS, which is for bunion surgery and even hammer toe surgery. We can equate it to that. When do you say, okay, Miss Jones comes in, when are we skipping from the conservative care to the surgical care? And who is not a surgical patient? Because everybody thinks they can do surgery, and we know that's not the case. That question is for you.
Right. So usually I leave it up to the patient. I believe in patient autonomy. If I've been treating them, they come in most of the time for surgery. But depending on the patient, I always discuss, the risks and benefits of doing MIS. Minimal incision is great because it is lower risk of skin healing, which is like a big complication in most of the surgeries that we do. So, usually if the patient is like, I've had enough of, orthotics injections, I wear the widest shoes in town, I'm ready for surgery, and we go through those risks and they agree we do it. So, principles of MIS allow you to do it on patients that are higher risk for other surgeries. So there are a lot of like tendon transfers, exostectomies that are beneficial to diabetic patients with neuropathy. They have a chronic ulcer or a chronic deformity.
Wait. Remember, we're talking to regular folks.
Oh, I'm sorry. So,
explain neuropathy.
So people that have problems with healing in their feet, which are typically diabetics that can't feel anything, and which causes these problems, risk of them losing their toes or their feet. Minimally invasive offers the option of fixing those problems without putting the patient at risk of, not healing or infection. Even smokers, we typically don't like to do surgery in people that smoke nicotine. Even though I do advise my patients to stop smoking during the healing process, even if they're, naughty behind my back, the risks of them healing are, lower with minimal incision surgery. So it kind of broadens the field of who you want to help surgically that you couldn't with traditional corrective surgery in the foot. That's one of the reasons I really like it. And then, it's an easier sell too, to let patients know you can fix this and they can get back to, exercising within a month or 3 weeks. I tell them a month, but it can be, beneficial to, patients that are hesitant because of the time it takes for you to heal from traditional bunion or hammer toe surgery. So yeah.
Okay.
Dr. Clark gets her patients back into their own shoes in 2 weeks, which is pretty incredible.
We're going to talk about that off here, but that's amazing. Dr. Bell, you said you got the big hands, but you made me laugh. So here Miss Jones comes. She was walking. She fell, as a Trinidadian to say, and she fell down and broke her foot. Now, we have patients who dance. Maybe she's a dancer. I know I had a good friend from Dr. Burns who broke her fifth metatarsal while we were in school. So now I'm in the ER, I'm mad, I'm in pain. And I know here comes Dr. Bell. Tell us about how, and fifth metatarsal for those, let me turn my hand this way, is the side bone here that's common. So sometimes you get me two-step on, line dancing. What's the new one with the fan? I forget what that is, but that, whatever you're doing, okay? Roller skating, you may land badly and break that. You're upset, you're in the ER, the hospital is like, we have to call podiatry. And you come and you see or assess this patient, or the patient is, wrapped up and sent to your office. Tell us about how you fix these broken bones.
So, my protocol is always going to be based on how bad the injury was, is usually my number one. And my number two is lifestyle. So by lifestyle, I do get a lot of the Broadway girls that work on Broadway. So if it's a dancer or if it's an athlete, because we do a lot of sports medicine. So recently we had like an influx of like NBA players, but that are kind of like D-League, which are still great, by the way. But if it's someone like that, that's very active, the goal is to get them back to that activity. So I know that sitting them out in a cast and allowing it to heal in a cast is not ideal for someone like that. If it's my older patient that's maybe a little more sedentary, maybe have some comorbidities, then of course, they would be more ideal to kind of cast recovery. But someone who we see in our demographic or the population that we work with, a lot of times it's, okay, this happened. Let's talk about goals of care, where you want to be. And then we start working up a treatment plan from there. So that dictates what I like to do. So if a patient comes in who's very active and they're like, look, Dr. Bell, I can't sit out, I need to get back to activity, then we have, serious conversation. And then I also mentioned realistic expectations, right? Because everyone thinks that you're right back to it. And that's not the case. Foot surgery sucks. It's not the best.
I've had foot surgery besides being a surgeon. So
yes, it is hard to heal because you need your feet to get around. And we don't account for gravity a lot of times. And we know gravity pulls everything down. So now that foot's swollen and all the things that can occur. However, to answer your question, though, it's always going to be based on deformity or injury and lifestyle for goals of care.
Thank you. Thank you so much. I see that. Let me make sure I'm saying this right. Lib Garu. I think I'm saying that right. Thank you for tuning in. We appreciate you. Maggie Dean says, happy birthday. Well, it's happy anniversary, but thank you so much. So, Dr. Artis, I'm coming in. I hear about this female practice, and I walk in and I see you, and I'm like, okay, I like all these women. I see you. I'm kind of nervous because my heel is killing me. And I'm like, this lady better get me out of pain. And I'm looking at you. Tell me your approach.
Okay. So first, definitely try to make her, feel comfortable, introduce myself. And sometimes before I get straight to like the heel pain, I just start to ask like, where are you from? Are you from New York? Because a lot of our patients, our patients are not from New York. So it's like, okay, where are you from? And if we have something in common. So that's the first thing. Once we pass that, then, definitely work her up and find out, exactly where she's having the heel pain. We do our x-rays. Myself. So I also, depending if she, how bad the pain is, if it's like a 10 out of 10 and you need to be out of pain today,
Dr. Artis,
today,
I got things to do.
Miss Jones, we gonna get you right today. That's the plan. So if you are okay with like a steroid injection, that's something that we would talk about. So I kind of go through all the options. Do you want an oral and things like that?
NSAID, that's a big word.
NSAID, so non-steroidal, anti-inflammatory.
Give us an example.
Advil for the common folk, right?
Yes, Advil, Motrin, ibuprofen, things like that. But, I definitely check your medical history. That's number one foremost.
I got the pressure.
Yeah, see.
Jones has pressure.
So, Ms. Jones, I definitely go over your medications. What are you taking? If you have any allergies. So before I get to, okay, this is the actual plan, I have to know more about you. once I get a thorough history about you, then we can come up with a better plan to help get you out of your pain today.
And Dr. Alani, Miss Jones' cousin comes in. She's diabetic, and we know diabetes affects the Black community, whether you're African American, Afro Latino, whether you are from South America. I don't care where you're from. Our African brothers and sisters, we got diabetes, and she's looking at you because she noticed that she has a small little wound on her toe that she says like, oh, I've been putting bacitracin on it, and it's not really healing. How do you approach that? Because sometimes fear prevents people from coming in, or I've got this, I don't need a doctor. But now she's like, yeah, maybe I don't got this. And everybody told me I could lose my toe. What's your approach to that type of patient?
Yeah, so we don't see a ton of diabetics in our practice, but what my favorite explanation is the diabetic patient education. And I really like to educate the patients, because I feel like with our diabetic patients, no matter what demographic they come from, they don't really understand how it works. And so, having high sugar, how does that affect you, and how does that affect them, and how does it affect their healing? So I take them through a little analogy, and it's not I want to say it's not 100% accurate, but it's a very good analogy. And that's, you sip water through a straw, and the water can get everywhere it needs to really easily. But when you add a lot of sugar and you sip milkshake through a straw, that fluid is really thick, it's sticky, it's hard to get at where it needs to go, and it doesn't get to the farther places in the foot. So the healing is a little slower, and and then I go on to the neuropathic talk, where nerves are really sensitive. But my favorite part of the diabetic patient is the education, having them understand that the elevated sugars are going to prevent them from healing. And going on to say, with a wound, that taking away the devitalized, or the kind of the scar tissue that is not healthy around the wound, is going to help that, help bring more blood flow to the wound and help it heal. And that it may take several treatments to get that wound healed. And we look at their shoes, and we give them the shoe education, and we look at their feet and their x-rays and see if there's a deforming force that is causing the wound, and kind of give a really full picture. And we're very fortunate in our practice that we can take a lot of time with our patients for education, but they're getting a really thorough education about their shoes. We look at their shoes, we're padding them up, we're sending them home with a lot of educational resources to say, look this up and read about this, and understand it better, as well as ensuring that they have a primary care doctor, which often, when they're coming to see us for no matter what problem they have, they haven't seen a primary care in a long time, and no one's really following up on their overall health. So that was a very long answer to your question, but Mrs. Jones's cousin will be well taken care of. Along with all the bells and whistles we can offer, like the Prisma and the Blastex to help close the wound, we want to make sure that Mrs. Jones's cousin never has a wound ever again, and that she is well aware of how her elevated blood sugars need to be controlled, as well as she understands it well enough to tell all her friends and family on why it's important for them to control their blood sugar.
Amazing. So Tiffany, here we go, Dr. Gooden. So, before now I fixed my, I'm going to get my bunion fixed. My cousin's toe is going to, okay. Now I have insurance questions, and you're going to talk about copays. I know that comes through our COO. How do you make your patients comfortable with understanding how insurance works? Because a lot of times people don't know they need a referral. They don't know that there's a copay because you're a specialist. And sometimes you get questions. I think New York City probably is a little bit easier than most, but still it applies to multiple practices across the United States. How do you make your patients feel comfortable understanding their insurance and what they may owe and not owe, and what's covered and what's not covered?
So it doesn't come directly through me, but what I'll say is that with our growth as a practice, and our expansion to a larger team as well, because when I first started, there were 3 doctors and 2 locations, maybe kind of 1.5 locations, we're up to the 4. So with that expansion, we've really had to do a lot of training. And even recently, every time things change, we make sure everyone is trained on how to explain benefits to patients if they call in, how to explain what their deductible is, what their copay is. And so it's consistent, right? So, luckily, knock on wood somewhere, we haven't had very much staff turnover lately, but it's constant training, right? You want your medical assistants to be able to understand. You want your medical receptionist to be able to understand.
Absolutely.
We have a monthly meeting with all of the doctors to go over new things and changes that are going on so that everyone is on the same page about how to explain these things as well to the patients. So I think that for most of it, it's just continuous, ongoing education.
I think that's a perfect answer. Too many times people come in, I didn't know, I don't understand.
Oh, no.
And it starts from the front desk. I always tell people it starts from the front desk, from the phone call, so that people are like, well, I didn't know, you didn't tell me. Oh my gosh, you're trying to bill me extra and all those types of things. So I agree.
We also have a policy that, for us may not be the best thing, right? And Dr. Alati could attest to this, but we make sure that every patient is aware of those things before they come into the office.
Absolutely. And I think that's a big one.
So,
that you can't
so
say-
many doctors' offices, exactly, just let them come in, they get a bill later. We make sure that people know what those responsibilities are beforehand.
And that's important, because if you want patient retention, you don't want somebody being mad because they owe you $100. You want them to know they owe $100 before coming in so that they're prepared.
Yeah.
However, that
unfortunately, it may cause some cancellations, right? When
but
you're
it's better
doing
to
it
know
beforehand.
and
But
retain than to have and never come
Exactly.
back. And then they're like, that office, did you hear about the healthy feet podiatry? I owe $250.
Yep. Yeah, and we want to gain trust with our patients, right? Because otherwise they're not going to refer us to other people, to their friends, to their communities. So we always try and make sure they're aware of that beforehand.
So I'm coming down to some of my last questions. And one of the questions that I like to ask is, I love practices that leave a community footprint. Practices that may participate in something for the sorority, some practices that may do something for the New York Marathon, a community-based organization, speaking engagements. Obviously you're on this platform and I am the queen of that. Dr. Lani, what would you say your community presence or footprint is, or what you'd like it to be, that people are like, that's the practice?
Yeah, that's a great question. So I'll start with something we do, and then I'll go to something that I would love for us to do.
Mm-hmm.
So as a team, we often have students that are in high school or in college come and do some shadowing with us, so that we can be mentors. They can learn about the field, they can learn about medicine, and that they have the opportunity to see what it's like in podiatry, or even see what medicine is like. My first experience in podiatry and in medicine was in a similar manner. So if I hadn't seen what people were able to accomplish in this field, I would have never gotten into it. And so we do that on a regular basis by hosting younger folks who are interested or even not interested, to just show them what this is about. As a team, I would love us to do more of that. And formalize it. And we've started some talks with different groups of young women, those that are in high school and some in early college years. And we haven't really proceeded with any of that. COVID happened, and then the expansion happened, and new team happened. And so I hope that mentorship is something we can continue to do in a formal manner.
Mm-hmm.
And then in terms of our kind of community footprint, I think each of us has something we do individually. And for myself, I contribute a lot of my time to a faith-based community, but it involves the help of all the people in the zip code, or all their neighbors, or all their friends and family. And right now I'm specifically helping newly arrived people who are affected by the Ukraine war and displaced, and helping them with their settlement here in the United States.
Fantastic. I'm going to ask the same questions to all of you, 30 seconds or less. I'll just start with Dr. Clark. What is your community footprint?
Well, outside of this practice, I participate in a nonprofit organization called I Am Cultured. Actually, the founder of the nonprofit, Carmia Berry, is one of your sorors. And we went to Hampton University together. We were on the same.
Wait. For everybody watching, the HU, the real HU, because you and Howard folks cracked me up with that. So I just want to put that out there, because somebody's going to comment. We have said it.
I'm not gonna cause discourse. This is not the place for it. This is Unity and Women's Month. So, but yes, attended Hampton University with Carmia. She founded this organization, which is pretty much mentoring high school sophomores to seniors, and they go to a different country. So we expand their classroom outside of the classroom. They're currently in Colombia now, and leading to their trips, we do workshops and we mentor them from different professions. So I have a group of mentees that I take care of every year as far as introducing them to, the medical profession and trying to help them sort out what they would like to do after they finish college. So that is my footprint in the community, and that's in Brooklyn.
Thank you. Dr. Artist, 30 seconds or less. What's your community footprint?
Community footprint, I work with the youth at my church. So I was doing like Sunday school with the little kids, but now I'm actually working more with like the youth, like the teenagers.
I love
So yeah, just taking time, talking to them, getting to understand them better, because sometimes it's hard. This day and age is different from when we grew up. So yeah, that's my
That's your
community
footprint.
service. Mm-hmm.
Dr. Allison Bell, 30 seconds or less.
Okay, so for me, I do a lot in the podiatry community. I do a lot of mentorship and boards prep on the side with a lot of the podiatry residents.
I love it. Mm-hmm.
And podiatry students. And then most recently, I just got to give a quick plug. I am going to be lecturing for Clark's Caring Circle. It is a scholarship program for youth in Brooklyn. So I will be doing the podiatry lecture on foot care. They're doing a big spa day May 10th in Brooklyn.
Very nice. Well, I would just tickle pink that I had you all on. Dr. Gooden, Dr. Alani, Dr. Clark, Dr. Artist, Dr. Bell, thank you. Dr. Alani, quickly in 30 seconds or less, where can we find this fabulous, not practice, guys, practices?
Yeah, you can find us online at tohealthyfeet.com, and it's TO Healthy Feet. So think of it as a journey to healthy feet. And that's where we are. Our physical locations are downtown Manhattan, uptown at 73rd and 3rd, the Times Square area at 39th and Broadway, and then by Grand Central at 41st and Lexington. So all very accessible by the trains and then by all subways. And we hope to see you guys all somewhere soon.
And I just want to say thank you. This is 1 year for Stepping Forward with Dr. D, and we're going to keep going into year 2. I want to give some great news. Asia Bailey, put up the flyer. Yes, for all those asking. Dr. D is back in Essex County, New Jersey in private practice. I have joined a fabulous group, which we're going to give more information. You got to tune in, you got to subscribe first. And then if you want to make an appointment with me, you can find me everywhere at Talks with Dr. D or info@talkswithdrd.com. I am back. I know my patients are happy who are like, you left us, I'm back. And I will be in Belleville starting March 17th. I hope you support. And I'll be growing in Essex County and be sharing it in my show as we go. This show, as someone's asking, is a monthly show. It is the first Wednesday each month at 7 o'clock. And next month, we will have on fabulous doctors, Dr. Reza Langrudi and Dr. Nazila Eshraghi, the Persian persuasion, as I always tease them about. And they're fabulous, talking about their practices and what they've developed in their practices to benefit their patients from the West Coast to the East Coast. I am so glad that everyone is tuned in. Realize that Talks for Dr. D is a movement, the breast cancer arm. We have Sisters on the Vineyard, which will be taking place August 12th in Oak Bluffs, darling, in August, which we all gather for board certified doctors, sponsored by Big Pharma, also sponsored by JP Morgan, and all those great things to learn about healthy wealth living lifestyles. To learn more about it, you're going to have to keep tuning in and come to my webpage, Talks for Dr. D. I'm on all social media, LinkedIn, Facebook, Instagram, Talks for Dr. D. Thank you so much for tuning in. Thank you. Everybody wave to the camera. And for the sorority sisters of the Alpha Kappa Alpha sorority, your sorors are on. Throw that pinky up, ladies. We appreciate you supporting us. Bye.